Hi, welcome back to Dr. Nilani Mind and Medicine, my YouTube channel. So thank you so much for all your comments, likes, shares and for subscribing. So to my channel, so your kind words, guidance and continuous encouragement truly motivate me to keep creating these educational videos and sharing my knowledge with you. Eventually, over many years, I have studied, research, and work deeply in health and anatomy. And I have gathered a strong foundation of scientific evidence and clinical understanding, especially related to the structure of the human body. So, through this journey, I have also learned how different anatomical changes can lead to pain, discomfort, and common health problems that many people experience in daily lives. Billions of people affecting spinal cord related problems worldwide. So, my goal is to simply this knowledge and share it with you in a clear and practical way. So you can better understand your body, recognize possible problems early, and take better care of your health. So your support truly inspires me to continue this journey, and I am grateful to have you here with me. What we cover in today. So as you know, this channel is all about health educations, so awareness and preventions. So in my previous video, I have already discussed about the cervical region, which is upper area neck. So the thoracic regions, so upper and mid back. So the lumbar regions, lower back. And I have divided the spine into four main parts: cervical, thoracic, and lumbar, and sacrum. According to that, today I'm going to talk about the sacrum, which is this last part of the human spinal cord. Today's focus is the sacrum, so which is the spinal part of the spine and plays a very important role in pelvic stability, sitting and standing, and overall body balance. Quick remember or simple summary. So before going too deeper, I just want to briefly summarize and remind you to these regions. Sometimes it's easy to get confused between different body parts. So this recap is only for your general knowledge. Just remember the spine in these four parts and everything will make much more sense. So important promise, remember, last week I promised you that I would talk more deeply about the common spinal problems, for example, especially sciatica. So because many people suffer with low back pain, sciatica, some like a common problems. So I would like to talk more deeply. So each week, like every sections. So which affects many people, so particularly women. Like I will not go into full details today, but in my next videos I will clearly explain that. So for example, what is the sciatica is, so why it happens, and what is the common symptoms, how preventions. So all about I will talk my next video. So let's talk about our final part of our spinal cord, sacrum. First of all, I will briefly show you two main body parts of sacrum. So keep your general knowledge. This is our human body, the spinal cord. So I have a talk up to here, lumbar region. So this is the base of sacrum. So this is the sacrum, and this is the coccygeal, or this is the tailbone. And so this is like a This is I want to turn other side. I will show you. This is the sacroiliac joint. Because very common problem, this sacroiliac joint problem. It is when we talk about the sacrum. So this is the very common problem, sacroiliac joint defunctions problem. And so this is our hip joint. This one. So hip joint. So and this is the iliums, and also this is the ilius crest. And this the what we call that pubic bone. This is the pubic bone. This is the pubic symphysis. This one. Symphysis. This is the pubic symphysis. This is which is the pubic bone joint area. So yeah. So keep your remember. This is a very briefly summarize about the pelvic bone. Just for your general knowledge. Our sacrum, so pelvic area connections, pelvic. So this is the pelvic, and then hips and lower this area, lower bowel and bladder nerves. This area, right? So common problems, sacroiliac joint dysfunctions, as I mentioned previously. So pelvic imbalance. So this is the sacroiliac joint. This is the very common problem, sacroiliac joint dysfunctions and pelvic imbalance, and also pain after pregnancy or long sitting. So common symptoms actually deep pelvic or tailbone pain. So pain while sitting and pain during standing up from sitting, and sacrum problems often feel deep and dull or sharp pain. I was discuss about the sacroiliac joint dysfunctions. The sacrum connects the spine to the pelvic through the SI joint. So when these joints move too much or too little, it causes pain. So pain is usually felt in lower back, buttock, one side of the pelvic. So pain may increases with standing, walking, or climbing stairs. And so next, I already discussed about the sacroiliac inflammations or SI joint. So inflammations of the sacroiliac joint common in women. Post-pregnancy, autoimmune conditions and symptoms are deep itching pain, morning stiffness, pain improves slightly with movement, and sacral misalignment, pelvic tilt. When the sacrum is not in its natural positions, often caused by poor posture, uneven sittings, or long hours of standing or sittings, lead to chronic low back pain. I forget not only that, so chronic low back pain and hip imbalance and muscle tightness also common problem. Actually, next I will talk about the sacral stress fractures. This is a very less common but seen in athletes and osteoporosis patients, and causes deep pain that worsens with activities. So, next I would talk about the prevention tips for sacrum's problem. So number one, maintain proper posture is very important. Sit with your hips level and avoid crossing legs for long period. Keep lower back supported. And number two, strengthen core and pelvic muscles. Focus on core muscles and glut muscles and pelvic floor. the sacrum stability. And number 3, regular stretching. So stretch hip flexors and hamstrings and lower back and reduces tensions on the sacrums. So number 4, avoid prolonged sittings. Take breaks every 30 to 45 minutes. It's very important for your healthy sacrum, because when your sacrum is not healthy, it's effect for your lower back or your hip joint or your pelvic area, especially for the pregnant woman. Stand, walk or stretch briefly. So keep your remember. And number 5, use proper lifting techniques. This is very important to you to know. So when you lift something, use always proper techniques. As I mentioned, use proper lifting techniques. Bend at knees, not the back. And if I possible, I will show you to how to sit, how to stand, and how to lift or how to stretch your body. So one day I will bring some videos for your knowledge. So avoid sudden twisting movements. Number 6, maintain healthy body weight. Excessive weight increases stress on the sacrums and SI joint. Finally, a healthy sacrum is essential for a strong, pain-free lower back. Simply daily habits can prevent long-term problems. Keep remember, a healthy sacrum is essential for a strong, pain-free lower back. Simple daily habits can prevent long-term problems. So thank you once again for being here and for trusting me and for learning with me. So if you enjoy my videos and find them helpful, please subscribe to my channel and click the bell icon. Don't forget to do that, because otherwise you may not see my new videos when they are uploaded. So your support helps me to continue creating valuable health, education and content for you. Remember, my last word for your spinal cord. Your spine is your foundations. Take care of it today so it can support you for your whole life. That's all for today. Thank you so much.